Win $1 million on NBC.
Morning comes early, work is waiting, living and giving a little more each day.
This week at Buttery, get 30% off all Revlon cosmetics for beautiful fall savings. And stock up on White Rain hair care products, just 79 cents each.
Here at Buttery, we're giving the West our best.
Yipes, I better help. Tempt your tummy with Honey Nut Cheerios? Wouldn't you rather have the taste of golden honey and crunchy nuts? Part of your complete breakfast.
It's Honey Nut Cheerios. Meep, meep.
You're watching KNDO Channel 23 Yakima. And this is News Center 23 with Mary Leonard, Ross Perrick Sports, and Monty Webb Weather. And now, News Center 23.
Good evening. We'll show you rights you have on the job in just a moment. First, our special team report on health care access here in the Valley. We all know where to get health care, but can we afford it? There are two main groups here that have trouble. People who can't afford insurance but don't qualify for special assistance, and teenagers. In our first report tonight, News Center's Jennifer Mandalay shows us the problem facing teenagers.
More teens than you think are not covered by their parents' health insurance. To add to the problem, a lot of jobs teens get, like fast food work, don't provide health coverage either. So what happens when a teen gets a sexually transmitted disease, depression, or other problem? Luckily, there is help, whether you've got health insurance or not.
Well, we have a variety of services available to teens, medical services, primary care services, basically for acute and chronic conditions. We do physicals, we do family planning, we do a lot of pregnancy testing and counseling for our prenatal clients who are teenagers.
For most of these services, there's a sliding fee scale, so young people can afford health care. Unfortunately, a lot of teens don't use the medical help that's out there. They let their problems grow until they end up in an emergency room. In order for health care to work, teens not only have to know it's out there, they have to use it.
I think that there are more teens out there who could benefit from our services than are seeking our services, yes. But with the Baby Your Baby campaign that's running now, hopefully they'll be better informed as to how to access the system. It's an easy 800 number. They call that number and they find out what services are available in Yakima County.
This clinic is one of many in Yakima where teens can go to get confidential medical care. Staff members here urge anyone who may have questions or may need a little more information to call here right away. In Yakima, Jennifer Mandalay, News Center.
Also, if you have any questions or need help, you can call our Baby Your Baby number right here on the screen. You don't have to be pregnant to use this service. Here's the number, 1-800, it disappeared, 282-3064. Or you can visit the Neighborhood Health Clinic on South 8th Street. Now, our News Center team report continues with a look at what's being done to help the so-called working poor. There are more than 800,000 people in our state who have jobs but don't have health insurance and don't make enough to afford needed care. News Center's Heather Bosch shows us what the state is trying to do to help.
An estimated 1 in 6 people in Washington state is risking financial ruin. They don't have health insurance, and if hit by a serious accident or illness, they could have to pay medical bills out of pocket. Many say they simply can't afford health insurance, even though they're working. For those people, the state could have an answer. It's called the Washington Basic Health Plan, and it's coming to Yakima.
The purpose of it is to provide basic health care coverage for persons whose income is too high to qualify for Medicaid, but they don't make enough money to be able to afford to buy private insurance.
The plan uses a combination of state money and private insurance companies to offer low insurance rates to those who qualify. It's not free.
These people pay a monthly premium. It's a reduced premium. It's based on income and family size. So it's not something that they're just being handed. It's something that, albeit they're paying a reduced rate, they're paying something, and I think that these people will feel better about paying for something. It causes them to take more responsibility in how they use the program, and I think the community feels better participating in it.
To qualify, you must earn less than 200% of the federal poverty level, but don't qualify for Medicare.
For example, for a family of two, the maximum yearly income is $16,840, so any family of two that would be at or below that income guideline would be eligible for basic health plan.
Officials say the Washington State Health Plan has been successful in Spokane and King counties. They say the health plan should be in Yakima by the end of the year. In Yakima for HealthWise, Heather Bosch, News Center.
And there's another number to call if you want more information on the state's basic health care program. That number is 1-800-826-2444. That's for the state's basic health care program. Autopsy results on the woman who fell from a downtown Yakima apartment building last week didn't turn up evidence of possibly being pushed. 41-year-old Lynn Jesko died after she fell from the second-story window. Her boyfriend, Muggsy Ray Van Tassel, was seen with her before and after her fatal fall, but he's not being charged with any crime yet. First, Van Tassel will be transferred to King County, where he's wanted for a parole violation and a felony warrant. The fatal fall here is still under investigation. And Yakima County prosecutors are also still investigating whether they'll retry Laurel Merker. Mrs. Merker was found not guilty of first-degree murder in the shooting death of her husband, but the jury couldn't decide on the lesser charges. Prosecutors still have to decide if they'll try Mrs. Merker on those other charges. Right now, she's free on her own recognizance. Long hours and low pay face many people in Yakima's workforce and in other cities as well. But some come across an even greater challenge: discrimination. Local employers got the official word today from the State Human Rights Commission on what they have to do to be fair to all workers. NewsCenter's legal correspondent Michael Rowe has our report.
Less than 30 years ago, people took to the streets to protest unfair treatment. Dr. Martin Luther King knew that for people to be protected, the law must provide shelter from discrimination. Today, the Human Rights Commission brings employers together to inform them of the laws relating to job discrimination. Like the weather, the law changes, sometimes unexpectedly.
Some of the complaints that are filed, employers are not aware that they were breaking the law, so to speak. A lot of them do not know. For example, an owner will not know that discrimination is going on in the workplace because the supervisor is the one that is harassing or discriminated against an individual. So we find a lot of complaints where the employers are not aware that those actions are occurring in their workplace.
Being up to date with the law means a business owner can make employment decisions fairly and get the most from his or her employees.
Well, employers want to eliminate any type of discrimination from their employment because they could be sued. It could end up costing them a lot of money.
The Washington State Human Rights Commission believes it's important for employers to come together in seminars like these to learn how to best protect their businesses and at the same time protect their employees from discrimination. Reporting from Yakima, Michael Rowe, News Center.
You can find out more about your rights by calling the State Human Rights Office. And State Employment Security Commissioner Isaiah Turner is out of a job tonight. The head of our Employment Security Department resigned today because a state audit found he'd misused more than $14,000 in state money. The audit says he used state funds for personal travel expenses and personal phone calls. Turner has already repaid nearly $7,000, and the state is asking him to pay back the rest. Now, prosecutors are looking into possible penalties for Turner. When we come back on News Center,